Good afternoon, everyone. We will get started here in just a couple short minutes. We're just going to give everybody a little bit of time to join. Well, we are going to go ahead and get started. Happy Friday afternoon to all of you and welcome. My name is Shannon McAdam, and I am the Region Senior Vice President of Development and Community Health here at the American Heart Association. I get to serve as your host for today's conversation, and I am joined by Dr. Alexis Ramirez from Fresno Heart and Surgical Hospital. It is my pleasure to welcome guests from across the Central Valley to the American Heart Association's community conversation about high blood pressure, sponsored by Community Health System. We are so excited to have you join us. Before we start, just a few notes for our audience. Please use the Q&A button on your Zoom toolbar to submit questions for a live or typed response. Use the chat button to introduce yourself and share your comments or thoughts. Also, be on the lookout for helpful resource links in the chat posted by the American Heart Association staff. If you would like live captioning of the presentation, use the closed caption button to turn on captions. And because this is a webinar, you don't need to worry about the mute unmute button, sharing, or anything else. Please sit back and relax with your virtual friends here. Now, I'd like to introduce you to our amazing volunteer expert today. Dr. Alexis Ramirez is a clinical educator for inpatient services at Fresno Heart and Surgical Hospital. She has worked as a registered nurse for 18 years. She completed her doctorate in nursing practice in 2021 and completed her master's in nursing education in 2014. She is board certified as a nursing professional development specialist and a critical care nurse. Her mission in life is to reflect the love of Christ while providing the highest quality of competent nursing care and teaching others to care for themselves and their community. Alexis oversees the professional development of clinical staff at the medical surgical team, telemetry, and cardiovascular unit at Fresno Heart. She actively works with the leadership team across Community Health System to facilitate the heart training of nurses for the Heart and Lung Institute at the regional Clovis and Fresno Heart campuses. Additionally, she is a clinical instructor at California State University, Fresno. It is a source of pride for her to mentor nurses as they transition into practice and throughout their professional career. We are so excited to have you with us today, Dr. Ramirez.
Shannon, thank you so much for that very warm welcome and introduction. I am so excited to be here on World Heart Day to talk with you all about a topic that is so important to your heart, your blood pressure. I am in the hospital today, so those of you in the audience, I just want to preface that if there is an overhead announcement made, I will put myself on mute until that is all clear, and I ask and appreciate your patience during that awkward silence as we go through this presentation. As an educator, I have found in my career that awareness is half of the battle when it comes to maintaining heart health. And I find it very interesting that nearly 1 in 2 adults, this is over 116 million people in the United States, They have high blood pressure, but they've never actually been diagnosed. According to a California Health Interview survey in 2021, 1 in 4 people have been diagnosed with high blood pressure. And then according to the American Heart Association's 2021 statistical update, only 22% of people actually have their blood pressure under control. We saw a slight improvement in the years of 2010 to 2000 to 2010. But since then, it's really been kind of a steady decline in people having their blood pressure under control. And this is in spite of having, access to various generic medications that are there to help treat high blood pressure. When you consider hypertension, high blood pressure, it truly is an epidemic within our communities, and it impacts some communities more than others. So next slide, here are some very quick statistics on blood pressure. I think it's interesting. 1 in 3 American adults have high blood pressure and don't know it. Having high blood pressure places you at a higher risk for having stroke. And by simply monitoring and controlling your blood pressure, you can significantly decrease that risk for stroke. Next slide. Honestly, there's just too many people out there who don't know that they have high blood pressure. And this is because there truly aren't any obvious signs most of the time. There's not any obvious signs. If you think for a moment, when you catch a respiratory infection, you get a cough, you have a runny nose, you have whatever symptoms come along with that, something in your body is telling you, I need to go see the doctor, something is wrong. That's not the case with uncontrolled high blood pressure. That is why it's often called a silent killer. A lot of people don't have access to quality health care, and as a result, it goes undetected. And when it goes undetected, you don't find it until you have a problem. Unfortunately, the burden, it's unjustly borne, and it is especially true in the African American communities. COVID-19 brought a lot of this to light, but if we want to prevent the loss of unnecessary time with those that we love, we really need to take some action. So let's talk a little bit about what your blood pressure actually is. When your heart beats, it pumps blood through all of your vessels. The pressure it creates a pressure going through those vessel walls, and that pressure is what allows your blood to flow throughout all of your body. High blood pressure is when your pressure is consistently too high. That can lead to other complications, which unfortunately we don't have time to delve into today. However, in the chat, you will find a resource that's being posted describing more of the complications and consequences of having high blood pressure. Now let's take some time to explore what your blood pressure numbers actually mean. Like every time you go to the doctor, they take your vitals, they take your blood pressure, but do they ever explain to you what those numbers mean? If not, we're going to do that now. Blood pressure is usually communicated in 2 numbers. The top number, which is your systolic pressure, is the pressure that your heart is using to pump your blood forward and move it through those arteries and vessels. It's the larger of the numbers, and in this example, you can see that it's 133. The bottom number, or the diastolic pressure, is the pressure that's in your heart when it relaxes so that it can fill up with blood and then pump some more. That's called your diastolic pressure, and it's the lower number of the two. And in this example, you can see that it's 81. So your blood pressure would be communicated 133 over 81 millimeters of mercury. When you're trying to remember all of this, the next time you go to the doctor and you're like, what is the diastolic number? Think D diastolic down. So that's the bottom number, and that's the number when your heart relaxes. Next slide. On the screen here, you can see the 5 blood pressure ranges that are recognized by the American Heart Association. Normal lies within, is less than 120 over 80. I don't want to read this whole slide to you and bore you all to death, but I really would like to highlight the bottom 2. Hypertension stage 2 and then hypertensive crisis. If you are monitoring your blood pressure at home and it is consistently over 140 over 90, it's greater than 140 over 90, you are at a higher risk of having potential complications related to your blood pressure. You really need to contact your provider and talk about a treatment plan to help you get your blood pressure under control. And then that bottom row there, if your blood pressure is consistently greater than 180 over 120, this is considered a medical emergency, and you really need to seek healthcare, see a doctor like immediately. Don't delay, don't wait and think it's going to come down, because you are at very high risk for having some serious complications. Next slide, please. So there are a number of factors and variables that can put you at greater risk of developing high blood pressure. Some of these things are out of your control. We call these non-modifiable risk factors. These are things like family history. If your parents or a blood relative, close blood relative, have high blood pressure, you're likely to have it as well. There's nothing you can really do about that. Hence the non-modifiable. Your age, you can't control your age. The older you get, the more likely you are to have higher blood pressure. Your gender, until the age of 64, men are typically more likely to get high blood pressure. At the age of 65, the reverse is true. Women are more likely to have high blood pressure. And then race. As we discussed earlier, African Americans tend to develop high blood pressure more often than other people of other racial backgrounds in the United States. And unfortunately, it tends to be more severe, and a lot of the medications, I shouldn't say a lot of, some of the medications are less effective when treating hypertension. We're going to take a closer look at the link between racism and blood pressure here shortly. But before I get there, I want to talk to you about chronic kidney disease. It's kind of a never-ending vicious cycle with blood pressure. High blood pressure can cause kidney disease to be worse. Having kidney disease can cause having higher blood pressure. So it's kind of like this cycle that you get into when you have chronic kidney disease. But those are risk factors that you may not be able to change. There are risk factors that are in your control. We call these modifiable risk factors. And these are things that you have the power to change, your diet, your lifestyle, exercise. I don't have time to really go into those modifiable risk factors, but in the chat, you will find a link to the American Heart Association's Life's Essential 8s webpage. It's being posted there now, and it has key measures that you can implement to improve and maintain your cardiovascular health. I'd like to circle back and take a moment to discuss how a lifetime of discrimination may boost high blood pressure risks in African Americans. Research has shown that concern about discrimination among Black Americans fuels health problems, including lack of sleep, depression. In a study published in 2014 by the American Journal of Public Health, researchers culled data from 2001 to 2003 in a Chicago community acute health survey. They were studying the relationship between race-related vigilance, another way of saying that, just anticipation of discrimination, and hypertension. In this study of more than 3,100 people, they found that Black people reported higher levels of stress linked to being treated negatively because of their race. They concluded in this study that vigilance, or that anticipation of discrimination, may represent an important, unique source of chronic stress that contributes to the well-documented higher prevalence of hypertension among Blacks versus whites. In a federal study, it was shown that there's an exponentially higher rate of Black Americans, 40 per each 100,000 for women and 50 for each 100,000 for men, who die from hypertension than white Americans, which is about 15 per 100,000. This study suggested that chronic stress linked to racism is as great a risk factor for high blood pressure and heart health related conditions as smoking or having high cholesterol. So the stigmatism is real, and the chronic stress related to racism increases and can boost high blood pressure risk for African Americans. Now, if you're diagnosed with high blood pressure, your systolic is consistently greater than 130, your diastolic is consistently greater than 80, your healthcare provider may recommend a couple of the following. They may want you to monitor your blood pressure at home. They may develop a treatment plan that includes some lifestyle changes. You may need to take prescription medications so that they can help you get better control of that. To help you get your blood pressure under control, it's just a good habit to get into checking your blood pressure at home. It will require the use of a self-monitoring blood pressure device. The American Heart Association recommends that you use a device that has an arm cuff with the appropriate size. Most standard cuffs fit most people. However, if you have a larger upper arm, you may need to purchase a cuff that fits you so that you can get an accurate pressure. The American Heart Association doesn't recommend a particular device. Just make sure you get something that's on the validated list when it comes to monitoring your blood pressure at home. When you take accurate readings at home, this helps you, monitor and trend your own blood pressure, and then you can share that with your healthcare provider. This gives your provider a much clearer picture of how you're trending, how you're doing with controlling your blood pressure, and whatever regimen or treatment plan they have you on, how effective it is. So it's good practice. Track it and share that with your healthcare provider. In conclusion, I really hope that all of you are empowered by the talk and can leave here and identify at least one thing that you can do to help improve your heart health and control your blood pressure. Hopefully those links in the chat are helpful for you and putting some strategies in place to improve your own heart health. The American Heart Association has several tools that will help you learn about blood pressure. Basic blood pressure monitoring, the links between blood pressure and your diet, the links between blood pressure and stress and exercise. So we'll post those links in the chat at the end of this, and we'll email them to you at the end of this webinar. Right now in the chat, you should also be able to access an infographic on how to properly monitor your blood pressure at home. So I'd like to thank all of you for joining us today and tuning in. I hope you found this information helpful. I'm going to turn it back over to Shannon.
Wonderful. Thank you so much, Dr. Ramirez, for all of that great insight and good nuggets today. We so appreciate you and your time. And I know we've got some questions that have been bubbling up. So we are going to take a few minutes and start talking through those questions. So they're coming at you, Dr. Ramirez. I'm going to turn it over to one of my colleagues to go ahead and ask some of those.
Hi, Dr. Ramirez. This one came in. The question is, do I have to take medication?
So sometimes, but not always. That is really going to be a question that you want to write down and save for your healthcare provider. They would have all of your information, be able to trend your data and give you an appropriate answer to whether you would need to take blood pressure medications or not. So to whoever asked that question, please write that one down. Take that back to your healthcare provider because they're going to have the details of your condition and can better advise you on that. I hope that helped.
I've got one more. What is like the best way for me to prevent high blood pressure? Is it better to start with diet? Is it better to start with exercise?
I don't know if there is a better to start with answer, but not having a sedentary lifestyle, exercising routinely to tolerance, modifying your diet so that you're avoiding those high risk foods that would elevate your blood pressure, high in sodium, high in fat. Those are all going to be good strategies to implement. I would caution, you try to implement everything all at once and then it becomes overwhelming and it can seem impossible and then you're less likely to stick with it. Whereas if you gradually take time and implement those changes, it becomes something more manageable. Ultimately, you're going to want to talk to your provider about that as well to see where a good place to start would be. I would hate for you to leave here and think, oh, I'm just going to change my diet, and then you have another condition where changing your diet makes that worse. So those are all good strategies to implement, but run all of those by your healthcare provider so that they can closely monitor you as you're implementing those strategies.
Okay, Dr. Ramirez, we have one more. Will insurance cover an at-home blood pressure kit?
I'm sorry, can you repeat that one?
Will insurance cover an at-home blood pressure kit?
Oh, I don't know that answer. If anyone on the panel does know that, please jump in. But my default response would definitely be to talk to your provider because I want to say that it does, but ask them.
I am not sure of that answer either. So I would definitely agree. Dr. Rivera is probably wise to check with your provider and see if you've got
if your insurance will cover
get that. Yeah, absolutely. Okay, well, we were able today to touch on some information about blood pressure, and we do want to leave you with some additional resources. So please take a peek at the chat for some links to the information. If there are any questions that come up maybe later in your day today that you didn't get a chance to ask, or if there is anything that we did not have a chance to get to, please know that we can follow up with them via email. A big thank you to Community Health System for sponsoring this event. And thank you, Dr. Ramirez, so much. And lastly, to all of you for listening with open ears and contributing to the conversation and for tuning in today. This webinar will be posted to the American Heart Association's YouTube channel. A link will be provided in the follow-up email. So please feel free to share or rewatch the content. And we wish you all a fantastic Friday and a wonderful and safe weekend. Thank you all so much. Take care. Bye-bye.
Thank you.